The broadcast is now starting. All attendees are in listen-only mode.
Good morning, everyone, and welcome to the Advocacy Webinar for today. Let me make Tony our organizer, and let's make it going. I couldn't hear you. Good morning, everybody. Hope you're enjoying this beautiful spring day. Wanted to get you all caught up to date on what is going on at the State House. It's extremely busy before all of the legislators take off for summer break, and then they probably won't return until October at the earliest, and maybe they won't even return until after the election. You know, everybody in the House is up for election this year, and half of the senators are. So they will be working on elections and those types of things. Wanted to first off talk to you about what is going on at the State House. House bill, and you may not be seeing these things. I don't know what you're seeing. We're working right now diligently, poor Derek, to get everything on screen. House Bill 483, which we had talked about House Bill, I think, 472 as being the mid-biennium review budget bill. That was kind of rolled into House Bill 483, which is another mid-biennium review. It was passed out of the House, still with some $47.5 million earmark. I know that there are some boards that are concerned about this and what is happening with those monies. I also know that there was some concern from the National Alliance of Mental Illness over how some of that money is spent. From a prevention standpoint, the prevention money is still in that budget, and there has been a lot of talk about how this is going to be worked out, where all of this money is going to be spent, whether it's going to be sent to the boards. From what I remember, this is money that was this is part of the $50 million that was given to kind of cover the in case Medicaid expansion wasn't passed. Well, Medicaid expansion was passed, but we haven't seen that money come through. So there's a lot of things in play right now with this money, and it's being debated in the Senate right now. What I talked to some folks down at the State House. What everyone is kind of looking at right now is that this is going to go into conference committee. Conference committee is basically there will be 3 senators and 3 Democrats three House folks that are chosen. There will probably be 2 Republicans with 1 Democrat senator and 2 Republicans and 1 Democrat from the House that will make up the conference committee. Don't know who those folks are as of yet. We're hearing that one might be Bill Coley. We're hearing one might be Shannon Jones. Or we hear, and these are all Senate. So I mean, there are some folks, but that is. Do not quote me on any of that because those are just what we're hearing as rumors down at the State House. But that's probably how that is going to be worked out is through conference committee. It will be kind of a closed door. They will iron out their differences and then come up with something that they both agree on before it is taken to both the House and the Senate chambers and signed by the governor. Now, they want everything to be passed by June 1st so they can go on their summer break, if not before, which leaves about however many 11 days or something like that. They would actually like it before the Memorial Day weekend. But June 1st is what they've kind of given the deadline to be. There's a lot of work to be done before that, but they need to get this out before they leave for summer break. Also, I'll continue to update on what is going to what is going on there and how that's looking. There's another bill that is kind of interesting to me. It's another mid-biennium review. It's the mid-biennium review Human Services Bill, which is House Bill 485. What the House did for that, and this might also have to go to a conference committee, what the House did, interestingly enough, they were not, there was not enough time that some of the opiate bills, which is House Bill 314, House Bill 341, House Bill 366, there was not enough time for those bills to be debated over in the Senate, and they wanted them passed. So what they did was they threw them into House Bill 485. And House Bill 314 is the parental consent bill, which is basically that a minor would have to have parental consent before an opiate could be prescribed to them. House Bill 341 is the ORS, which is the which is kind of the database that prescribers and pharmacists are able to use to look at patients and see what kind of prescriptions they're getting. That would actually be a requirement that there would have to be some patient review. That's 341. And then 366, the hospice requirements, which is that there would have to be a point person that would be chosen within a hospice organization to kind of track and make sure that opiates are not used or they're disposed of. Opiates are not used in excess, and they're accounted for, and all of that kind of stuff. And then when after the person does pass away, that those opiates are collected and disposed of or taken back to the hospice organization. So those three bills were thrown in at the last minute as amendments into House Bill 485, which is a budget bill. There were a lot of questions from senators saying, why did you do this? This is a budget bill that is about spending, and you threw these opiate bills in. So there's a lot of debate going on what they're going to do with that, whether they're going to remove them. What happens, basically if those three bills do not get passed, then they probably won't in the fall either, unless it's the lame duck session, which would happen after the elections. So lots of questions, not a whole lot of answers going on with either of those bills. Just interesting that what happens to legislation when there's a time crunch. So they can throw them into different things. They can kind of have conference committee, all kinds of stuff going on. And as I find out what happens with these, I will certainly let everybody know. It'd be good to be on next month's webinar in June to make sure that we, hopefully I'll have some answers by then on what has happened with these two bills. Wanted to go on to, if I can, wanted to go on, a lot of news about powdered alcohol, which is under the company who makes it is calling it Palcohol. What is powdered alcohol? It's just that, just kind of exactly the way it sounds. It is alcohol that has been broken down into a powder. The folks who create this have actually, have said, well, if you're out hiking, if you're out doing something and you don't want to carry your alcohol around, you can carry this this product around and sprinkle it on guacamole or whatever you want to do. And if you see there, it's 58% alcohol by weight. That is something that is kind of, if you want different kinds, there are actually different kinds, which we'll look at in just a little bit, which then have different amounts of alcohol in it. Some concerns, there's all kinds of concerns with this, and would actually like to hear some folks' thoughts on what is, what's your opinion of this? Right now, if we could go to the next slide, I don't know what I'm doing. The status is there's been a couple of quotes that have been out there. Senator Chuck Schumer, who's a New York senator, and he basically came out pretty strongly against it. He calls it the Kool-Aid of teenage binge drinking. His concerns were that this would fall into the hands of children, that it's pretty easily concealed. It comes in a pouch that can be put in your pocket or carried in a backpack or whatever else. His concerns also are about snorting it and all kinds of those things. So he's actually fighting on a national front to actually have this product banned. I also put a quote in because there's been a lot of confusion. Is it legal? Is it not legal? And it says for about a week it appeared as if the U.S. Alcohol and Tobacco Tax and Trade Bureau would approve alcohol. Now the branch of the U.S. Department of the Treasury has ignited controversy after it rejected it. Before the public could get its hands on alcohol's various flavors: Cosmopolitan, Mojito, and Lemon Drop. Basically, they said that it was the approval was an error due to mistakes on Lipsmark's label in terms of the amount of powder in various servings. So what happened was this was approved, this stuff, and if we want to go to the next slide, this was approved, but then there were labeling issues. So they said that the labels did not actually match the content and the volume in the powdered alcohol. So they said, oh, now it's we fix your labels and we'll see what we can do, basically. So I think there was so much public backlash that these types of things get passed all the time, and it's not it doesn't create the kind of backlash that this has done. So they just said, well, we've got labeling issues. We'll work with makers and then see what happens. Powdered alcohol was actually first approved back in 1974, so it's been around for a long, long time. However, this is the first time that it's really gone kind of to market and to a mass audience like it has. The Palcohol, which is the actual name of the product, be your. I think their slogan is like, let Palcohol be your pal if you're out of alcohol or something. Oh, there it is. It's take your pal wherever you go. So this is I guess your pal. But what happens is the creator of this is a guy named Mark Phillips, and he released a video on May 7th to basically kind of rebut all of the different controversy surrounding this. And he, in the video, he says, well, you really can't, you could snort it, but it burns really bad, so you wouldn't. And kids would never do that. And if you wanted to snort the whole pack, it would take about an hour. How he knows this, I don't know. I guess somebody did it, I guess. And it really is, we're marketing toward adults, and this is something that is not dangerous, and all of these types of things. So he came out with a rebuttal video, which means that they're still going to try to get this to market. And I've heard that it might be the fall when this actually makes it to market. Will it get to market? This will be an interesting dance that is taken up on. Mark Phillips wants it to happen. There are so many public health concerns with this product, especially surrounding underage drinking, especially surrounding safety of individuals. That you could just sprinkle it on whatever. Like they bring up guacamole for whatever reason. I don't know. Didn't know guacamole really needed that alcohol kick. kind of like guacamole without it. But they keep mentioning that, or if guacamole, any kind of. I think there was early on. They've taken it down since. If you want it on your breakfast cereal, your oatmeal, you could have it on your oatmeal. So will it get to market is a big question. What can we do? I think we really do need to start looking at this, and we're looking at this now to come up with some talking points, and we're going to create those talking points. Also, in my opinion, don't overreact at this point. Don't go out and start, oh my gosh, this is going to happen. We don't know what's going to happen. And like I said, the reason I brought up that it was first approved in '74 was we've lived, 40, almost, 40 years without it actually making it to market. So I don't think we overreact, but I think we also need to start coming up with our talking points, especially when the media comes to us. What do you think of this? Derek just put up the video that you can watch, Mark Phillips' rebuttal, and he's actually creating little drinks with it and putting a lime wedge and making it all look like an infomercial type of thing. But we will get talking points, some of the dangers that we are concerned with, especially. I think this just really, and I think our agency believes that this is a product that could really catch on with teens. And if it's highly, the ability to hide this is really, really strong. And you're talking, some of this, the vodka is 65% alcohol by volume. The kamikaze that we had on there was 56% alcohol by volume. So it really is, that's pretty strong stuff. And how much is a not a dose, but a serving of it? Those are things that are that got them in trouble in the first place, which is the labeling. There was not how much a dose was. What if you pour a whole bag, a pouch on your Wheaties or your Quaker Oats in the morning or whatever? What kind of how fast does this get you drunk, or what does this do to your body? And there's not a whole lot that was done. That's why they supposedly rejected it. So we will get talking points out. They will be coming in the next week or week and a half. And then one of the things that I think other states have started to take action already, that they're actually banning it. They're trying to ban it in their states before it even gets to market. So, is this something that we would want to do? Is this something that we would want to try to undertake, either in the lame duck session or introduced in the next General Assembly, which will probably happen next January or February, where all bills are, from this General Assembly are either killed or they're or passed, and then introduce it then. I did get the wholesalers, Beer and Wine Association, actually one of their members said that they're not for this at all. So it's always my concern is who would be backing or who would be opposing the ban on powdered alcohol. So I don't know who would come out in favor of it, but it might be something that might want to be discussed at one of our SPECA meetings, or actually on one of these calls, or email me, or whatever you want to do. I'd love to know what your thoughts are on this product and what you think some next steps as far as the prevention field should do. Going to the marijuana update now. Basically, what happened, May 6th was the primary, and the Ohio Rights Group, who is the group that is organizing the pro-marijuana side in the state with their Ohio Cannabis Rights Amendment, they wanted to have hundreds of volunteers show up at every poll and get like 500,000 signatures in a day. When they were asked about it, so I guess they did have some volunteers at some polling places. When they were asked about whether they actually made their goal of getting the 500,000, Mary Borden said, well, we did meet our goals. But she wouldn't come out and say, yes, we met our goals of 500,000. She also came out and said, well, you know, if we don't make it in 2014, we're going to make it for sure in 2015 or 2016. That tells me that I don't think they got their signatures, and quite frankly, I don't know how close they are to getting their signatures, especially on a volunteer ballot initiative. When you don't have paid signature gatherers in a in one of these types of campaigns, it's nearly impossible. But again, you know, with so much of the tide swinging toward you know, the legalization of marijuana, it really, I mean, and the free media that they get from this, it seems like every other week, you know, it could be one of those anomalies that could actually happen. So they did get the signatures. Nobody knows. They won't share their hand about how many signatures they actually got and how many they're away. What are our next steps? We're continuing to educate folks on the ballot initiative. I have 3 business groups that I'll be speaking to next week. Still trying to get them. We're meeting with another association at the state level to try to garner their support and get their I guess sign on. And it might not be public sign on until there's actually something on the ballot, but grooming those relationships and getting them at the level that, you know, when something does happen, when and if, that they're ready to step up and actually do something. Another thing that has been happening, do they have the national support? I heard a radio show last week from the Marijuana Policy Project, and the Marijuana Policy Project said basically they're going to leave these folks alone in Ohio. They're not lending their support. They're more focused on legalizing in Alaska for recreational purposes and Oregon, and so they're not really paying attention to Ohio a whole lot. However, the Marijuana Policy Project's communications director, Dan Riffle, is actually going to be speaking at an Ohio Supreme Court sponsored event tonight about marijuana legalization. So we will see what happens there. But those are, you know, basically, again, continue to educate folks on this. Colorado's not doing well. There's not, you know, with the number of drug driving arrests, the number of drug driving crashes and fatalities, the fatalities of, you know, of a couple of people because of the marijuana edibles, especially. This is not going well, and trying to cover it up and spin it is getting increasingly more difficult across the country. So again, I've always gone back to, if we can hold them off, I think that there will be so much public backlash with legalization, especially in Colorado, that it will be difficult to get it passed. There was some talk about proposing legislation that would allow children with usually some kind of epileptic seizure disorder to get marijuana, a special strain called Charlotte's Web. We have, in the last few legislative updates, it's now along the right-hand side. There are some tools, some resources that I encourage you to use to kind of educate yourself on what I call CBD, cannabidiol legislation. It's taking place all around the country. There's 2 brothers that are that actually created the Charlotte's Web strain. They're from Colorado, and they're trying to market it all over the place, Ohio included. And there was talk about legislation being introduced. However, I haven't heard of it recently, so I don't think it will be on unless it is going to be in lame duck session after November. But what we encourage is that there's also a drug that is in the FDA testing process. It's actually in human trials. 300 children are getting it currently right now in the United States. It's called Epidiolex. And basically this drug is CBD, which is cannabidiol, which is a component found in the marijuana plant. It's extracted from the marijuana plant, put into a single dosage form, and monitored by medical professionals. That is not happening if you're just taking it from the Stanley brothers, who are the Charlotte's Web creators, and kind of doing it yourself. Also, with the CBD Epidiolex that we've been supporting as an alternative to just allowing these kind of raw cannabis oil types of products that are being touted across the country. We're pushing this, that if this is something, it doesn't get the child high. There's also how does this affect a person long term. There have been some stories, some anecdotal evidence that this is a short-term fix, that this doesn't actually last long-term. So, how, and I'm talking about the Charlotte's Web, so how does this, what happens? Do you give more? Do you give, do you have to change out? So it's interesting how this will all turn out, and I encourage you to kind of get yourself updated and educated on the CBD. Like I said, there's CBD resources on our legislative updates, and they're a permanent fixture in that. So when you get it, it's on the right-hand side, and really, really good stuff. The Marijuana Policy Project I spoke about are actually here in Columbus, Ohio. Also wanted to update you about there's a ballot initiative going around in Toledo, Ohio. It would be a city ordinance that would decriminalize marijuana. And it's called the Sensible Marijuana Ordinance. Ohio is already a decriminalized state, which means you can get 100, I guess 3.5 ounces, and all you can get is a $150 fine. And as we go back, you're talking 3.5 ounces, you're talking almost 200 joints that you can have on your person, and only get the $150 fine. I don't know what this looks like, and I've been trying to find the actual ballot language somewhere. I don't know if I have to go up to Toledo and actually find someone, but I'll give an update on it soon. Right now, they have actually, instead of 2,200, it's about 2,800 of these 6,600 signatures needed, and it's being pushed by Northwest NORML, which is the National Organization to Reform Marijuana Laws, and their whole push is legalizing it for recreational purposes. They don't really take part in the whole medicinal argument. So I will continue to update folks on that. It's just an interesting little initiative that is up in Toledo, and don't quite know what it means, especially when Ohio's already a decrim state. So didn't know if there are any questions or anything.
There doesn't appear to be any questions at this time. If you do have a question, please feel free to ask the question into the questions section of the GoToWebinar navigation panel. On your screen are some upcoming events that we have. We've got a webinar today at 1 o'clock for the GAP network, where Kathy Gabe is our program coordinator for that. She'll be presenting on GAP. Also, OPEC is June 2nd through the 5th, and the registration deadline for that is this Friday, so you can register right from our website. Also, June 10th, we have our next Advocacy Webinar, as well as our program webinar focused on increasing gambling awareness. And there's still no questions at this time. So if you do have questions beyond the call, please feel free to contact Tony at 614-540-9985, extension 17, or tcoder at drugfreeactionalliance.org. Thank you all for your time this morning, and we look forward to talking to you soon. Bye-bye.